Okay, Assalamualaikum semua. So, before we start our class today, I'd like to discuss subjek last week punya lecture FCE. FCE. So FCE, so I share my screen. Previous lecture, FCE. So homework, I already given you all homework. So there is this one. Okay, there is a homework that you need to read. Your homework. This one recent. Okay, regarding the homework, this one. Your homework. Sorry. Okay, regarding this FCE, FCE systematic review, a systematic review. So, are performance-based measures predictive of work participation in patients with musculoskeletal disorders? Anyone read this article? Boleh anyone volunteer regarding what are the article about? Anyone? Boleh, siapa yang dah baca ni? This article. Okay, Nabila? Boleh cerita tentang artikel ni? Nabila? Baca tidak? Nabila? Takkan you tutup? I tanya ni. You baca ke tidak this article?
Nabila pergi toilet.
Siapa yang cakap tu? Yang cakap tadi siapa? Fatin eh? Yang cakap tadi Aida. So Aida, have you read this article? Baca tak Aida? Aida? Boleh terangkan this article? Have you read this article? So I expect that you all buat homework lah. Whatever article that I've asked you to read, so you need to read. Anyone? Ainul? Have you read this article?
Doktor, saya nak try jawab boleh?
Okay, siapa ni? Nurul?
Nur Natasha.
Siapa? Nurul
Ya saya.
Okay, Nurul Natasha. Very good, Nurul. So what are the article about? Just informal lah. Explain to apa.
Okay, so artikel ni pasal main question dia adalah how well do performance-based measures predict work participation in patient with MSD. So jawapannya adalah yes, sebab 4 out of 5 good quality studies reported better result on performance-based measure was predictive of work participation. And total semua artikel ada 18 articles, and then dia pecahkan jadi good quality and moderate quality. So 4 out of 5 tu sokong bahawa performance based measures predict work participation in patient with MSD. Alright, that's all.
Okay, good. Natasha. So the best part is that lifting test ni. Lifting test is the most performance based measurement. So when we want to predict people return to work, so we have to use performance measurement rather than physical ability. This article is a review article. Review article. When people review article, they have inclusion criteria. Almost review article, they only accept strong, high quality evidence. It means that randomized clinical trial lah, the minimum standard randomized clinical trial. So there is a control group. So when you want to do FCE, you have to include performance measurement. Performance measurement. Okay. So anyone read this article? Good, Natasha. Short-term FCE. Short-term FCE. Do anyone read this article? This is journal in the Journal of Occupational Rehabilitation. So in term of journal, in term of work, so a lot of journal lah. One of journal is occupational rehabilitation, and another journal work. Work. So anyone read this article? Just informal lah. Informal, very fast. What you understand with this article? Anyone? Eza? Mana Eza Nadia? Eza Nadia? Can you explain this article? You tak baca Eza? Anyone? So this article regarding when you want to use FSE, less may be best. So when you look at the FCE, especially FCE who have different protocol, some of them lot of protocol. But from this study, they compare. The long one, the standard one, the long one with the short one. So they want to evaluate the effectiveness of the short form protocol. So they use this cluster randomized control trial. So there is a comparison group lah, standardized protocol with the short FCE. It's been done in Canada, Alberta, Canada. So with 372 claimants, of whom 173 was tested with short form FCE. So they compare. So the administrative recovery outcome was similar within group as were claimant satisfaction rating. No statistically significant or clinically relevant differences were observed as on this outcome between groups. 43% reduction in functional assessment time was seen. So almost half of the time being spent on using short FCE. They reduce almost half. But there is no significant difference. All in the outcome, so all satisfied. And for people, for the client, client satisfaction also no difference. So the conclusion is that a short form FCE appears to reduce time of assessment while not affecting recovery outcomes when compared to standard FCE administration. So such a protocol may be efficient option for therapists performing fitness for work assessment. So whenever you want to, if you got a short form, short time for to do FCE is comparable with the standard FCE lah, because FCE ni quite extensive dia punya time ni. Okay, and then this article I like you all to read lah. Read the article. For example, value of FCE information in clinical setting for predicting return to work. This is more on prospective study, pre and post but dia punya dia punya masa tu panjang 1 year follow up ni. So one year follow up. So the objective to evaluate the quality of FCE information in predicting return to work. So they do prospective cohort study with the 220 chronic musculoskeletal disorders. So they follow up. They do follow up. So this there is a result obtained 145 patients ni. So the punya conclusion, there was a significant relation between FCE information and return to work without concurrent practices. The number of failed tests seem to be of significance for patients with ambiguous return to work prognosis. So when you conduct FCE, your patient diagnosis, you must be really understand, because this is the thing, need to understand when you want to do FCE. So this you can read again, If you don't read it, this one your homework lah, do reading, This one I think I tak bagi you lah, This another good article. Is a review article. Review ni dia buat systematic review. The data is from this Cochrane library. I like this Cochrane library because of what? Because a lot of systematic review at this Cochrane library. So this article regarding FCE evaluation for the prevention of occupational re-injuries in injured worker. So they have a review. FCE able to prevent occupational re-injuries injured worker. So people who did FCE, whether they're able to prevent occupational re-injuries. So when you did FCE, actually, FCE, you want to find the current ability of the worker before they return to work. Sometimes they have limitation. So that's why you want to do FCE. One of the objective of FCE to prevent occupational re-injuries. I mean, when they go back to work, they're injured again. That's why we do FCE. This is systematic review. So systematic review, the background. They have the background. The FCE used to assess workers' physical state of readiness to return to work after an injury and to make recommendation for the time and capacity in which they might return. FCE are also used to prevent re-injury after return to work. Despite being a commonly used tool, a little is known about how effective FCE in preventing occupational injuries. That's why they do this study, because there's no little information how effective FCE preventing occupational injuries. So this is the objective, to assess the effectiveness of FCE-based return to work, recommendation in preventing occupational injuries of injured workers, compare with no intervention or alternative intervention. So they did searching the database, the years for that. So the criteria in systematic review, they included the RCT, randomized control trial. So all these randomized control trial, this is the high standard of study. So what are the results? We found no studies that compare FCE to intervention. We found one RCT. Only one study involved with 372 participants, which a short form. They're using short form of FCE compared to the standard long form. FCE using Eisenhagen work system. There was no significant difference between the two forms of FCE. We rated the overall quality of the evidence is as low. So the conclusion, there is no evidence for and against the effectiveness of FCE compared to no intervention. Short version of FCE shows similar effectiveness to a long version in preventing re-injury. More RCTs are needed. So there is no evidence to say that when you do FCE, able to reduce the recurrent injuries. However, when you do a short version of FCE, similar in terms of effectiveness. So tak ada study. So from this, which is very good, this is the way kalau you kata nak buat research kan, you can do this research lah. But when you do experimental, it's taking time kan. You kena apa ni, ada grant, you buat full time, all that. So this is the way we read the article. So I expect you all to read. I will ask you to comment the article. So next time, please, guys, read the article. This is like your homework lah. Okay. Sekejap buka today punya lecture. Today punya lecture. Okay. Ada soalan tentang FCE? Semua faham
Tak ada. Faham, doktor.
Ya, bila suruh baca artikel, present buat tak tahu je. Tak boleh lah. Macam Natasha, very good. That's the way you project yourself. Natasha, kalau dah qualified, call saya. Nanti saya recommend untuk return to work. Okay. So this is our third lecture regarding work conditioning and work hardening program. Work conditioning and work hardening program. So this is the outline, the differences between work hardening and work conditioning, criteria for work hardening program, work hardening concept, the physical space, personal requirements, equipment, and a bit functional capacity assessment and work hardening program. So when talk about work hardening, actually is from American Commission for Accreditation of Rehabilitation Facilities. Actually, this been established by American psychologist Matheson in 1977. So when talk about hardening, is a highly structured, goal-oriented, individualized. So in hardening, the activity must be structured, must have a goal. The individual enter the program must have a goal lah. So the treatment program designed to maximize the ability to return to work. So people who having injury, their ability, they are unable to function in their previous job demand. That's why they come to this program. And then in this hardening, the thing that we address is productivity. Productivity means you have to produce something. I mean, there is a work task for you to produce. Must have outcome in work hardening program. And then safety. Safety very important. Because of what? Safety, you sometimes injuries is due to they're not taking care of the safety element. So we have to educate them in terms of safety, and at the same time safety able to reduce recurrent injuries. So when they go back to work, they can injure again. So we have to taking care of the safety. That's why when you enter our lab, we have to wear shoe lah, and suitable clothes lah. This one for safety also, and physical tolerance. You able to tolerate your physical. Some of them have a problem of cardiovascular because of some of them have off work. They didn't the punya fitness in terms of their cardiovascular because of the off work, kan? So we need to improve their physical tolerance and work behavior. Some of them have issue of motivation, work readiness. They're not ready. Probably they have trauma also. Trauma in sense of, for example, I experienced a case. They're having back injuries. It's a trauma for them. They're not confident. They're afraid that they're going to have re-injury. So you have to improve their work behavior. Work behavior can be their psychology and also can be their performance. For example, body mechanic. They are unable to perform a proper body mechanic. So you have to improve their behavior to, for example, to live in a proper body mechanic. In terms of lifting, carrying, in terms of stress management. Stress management also, sometimes they under stress, kan? Of course, when they working everywhere, got stress. But if they're unable to cope, they have negative coping strategy. This is not a good behavior. So you can make an intervention program how to proper manage their stress, and focus on patient residual function, performance capacity, and the job requirement. So you need to focus. You need to focus what are the lacking, the ability that can be improved, so according to their job requirement. For example, if they want to leave their job demand at their workplace, the load that they have to carry about 10 kilogram. So you need to focus the job demand needed for carrying, for example, 10 kilos. Whether they are able to perform in that loading intensity. So in work, we need to understand the intensity and also their hours duration and their intensity duration. For example, they have to make carrying 10 kilos for carrying that one for example 3 kilometers. 3 kilometers kan. The maximum carrying, they have to carry 10 kilo. So you have to concentrate on the job requirement. So another thing, focus on physical in terms of their biomechanical, their neuromuscular, cardiovascular, metabolic, functional, behavior, and vocational need. Cardiovascular, it means that, for example, if they have shortness of breath, kan, dia punya cardio capacity ni, for example, like apa ni, bomber kan, they working at the apa ni, bomber dia punya cardiovascular, they must be fit in terms of going back to work kan. So if there is issue of cardiovascular, they have short of breath, so you have to focus on that. So this is the thing when talk about work hardening. So when talk about hardening, you see that this picture. So if you got any question, just voice out. Voice out your punya voice. Jangan diam saja. So work hardening, the process, for example, if you look at this place, there's a lot of physical exercise, gym ball, mat. So these exercise improve their cardiovascular, their strength, neuromuscular, there is issue of neuromuscular. So this one, starting, we have to improve their cardiovascular first. That's why in work hardening is a team approach. It should be OT, physio, psychologist, and then the second one, you see, this one on simulated work task. Simulated work task for people who their job is lifting, for example. So they simulate their task in terms of lifting. So in work hardening program, we try to simulate simulation of their previous job demand. Then after that, they do a real task. For example, what are these picture ni? This picture, these people, what they do? This one. You all semua mana ni? Ada kan? So this picture, third picture, what they do? Plus, they do vacuum, kan? They do cleaning, vacuuming, at the aeroplane cockpit. Dekat aeroplane ni, they buat vacuum cleaning. So we When they do work hardening program, they will try to apa, do a real task, if possible lah. Uh, so probably this person, this period, trial period, at the real workplace. So this can talk about work hardening. Compared to work conditioning, is a work related also, a goal-oriented treatment program, but this is for subject with less complex condition. Ini dia kadang-kadang case ni banyak kompleks. Ada isu of behavioral, of work lama, very long time of work. So this subject for work conditioning for less complex condition were provided by a single discipline of up to 4 hours per day. It can be 2 hours, 1 hour, and single discipline. Can be physiotherapist only, can be OT only, or psychologist, because the condition probably not really serious. Limited to function and work-related physical conditioning. And then because of the condition is not complex, probably they have no issue of behavioral and psychological component. So there's no psychologist involved, right? Because there's no issue of behavioral and psychological components. So this is more, for example, like you have fracture. You have fracture at your tibial fibula. So you have weakness because of the fracture. You immobilize. So after immobilization, you need to improve their strength, the muscle strength, the range of motion, all that. So it's focused on the certain part only, not complex, the condition. Work conditioning treatment program focus on functional requirements of a job, of employment setting, incorporation basic physical conditioning such as restoration of flexibility, strength, coordination, and endurance. So this relate to work, but it's only focused on the requirement of the job setting. For example, these people having a back pain, kan? But motivation, all that they are good. So you focus on the dia punya back injuries lah. For example, this person job is involve carrying and lifting. So you just focus. You give them, for example, 2 hours per day training. They come, then you do home management. How to do exercise at home. This more on straightforward focus on the injury. Work conditioning is conducted after completion of acute care and before work hardening. Some of them, they have to do work conditioning, and they found that they have issue of behavioral and psychological. They can go to work hardening. So this work conditioning. Work conditioning also the avoidance of pain producing activity generate physical reconditioning. So when they're having a pain, for example, you try to avoid the pain. So this is about work conditioning. And your exercise, your aim to increase muscle strength and endurance. Their flexibility, their motor coordination, and cardiovascular fitness. So that's why They are very straightforward. They do 2 hours, then they're going back. They call it dynamic strength exercise. So in main objective of exercise work conditioning is to produce resistance and time. So if there is a weakness of the muscle strength, so we are in order to improve their strength, we have to give resistance and time. Time dia punya tolerant lah. How they able to tolerate time. So you can give them weight of the body, can come from the weight of the body or any of these segments, from free weight elastic bands or tubing or weight machine. So because all these things can give resistance. And then we give exercise, for example, isotonic. So this isotonic exercise, so you exercise again resistant. Again resistant. So you're able to improve your muscle in terms of concentric and eccentric activation muscle. And then you do isokinetic. So this is you giving resistance on a constant velocity. So this is called isokinetic exercise. And then isometric. Isometric is that your muscle not moving. So they call it isometric. So you perform again resistance at any point in joint strain or motion for a period of 5 to 10 seconds and produce no joint movement. So this is called isometric. So this is, when talk about conditioning, this is the exercise that you can give to the your client. It involves isotonic, isokinetic, and isometric. This machine in our lab this week, either you all come on Wednesday or Thursday, using this BTE primers. They call it BTE primers. So BTE primers, you can you can assess their isometric strength. From that, you half of the strength you give them as the resistance. First you do isometric, then you do isokinetic, then you do isotonic for their endurance. They will use this machine for exercise. So in terms of evidence, I should put. There is a study by Skorstein, 2003. Skorstein reviewed 23 qualified studies in relation to work conditioning, hardening, and functional restoration. So in this evidence, they found that if you do physical conditioning, you include cognitive behavior approach. For example, like you do aerobic, muscle strength, and endurance supervised by physiotherapists or multidisciplinary team seem to be effective in reducing the number of sick days for some workers with chronic back pain. So people who are having chronic back pain, if we do CB, cognitive behavior approach, but plus intensive physical training, for example, aerobic, muscle strength, but the case is chronic back pain. Supervised physiotherapist, because Skorstein is a physiotherapist. Actually, occupational therapy also can, because they said multidisciplinary team. So able to reduce the number of 6 days. But they put work conditioning and work hardening together. So when you want to do work conditioning and work hardening, so you need a referral from a physician. So doctor must refer and make sure the client is medically stable without serious diagnosis. Then approved funding source. Approved funding source means that when the workers coming to your department, I mean they have a special leave lah. So they pay their salary, probably dia transport dia punya dia punya transportation ada. So if not, is going to waste. Kalau dia terpaksa tak dapat gaji, kena berhenti kan, it's not good lah. So my employer must support this program. If you want to do this work hardening and work conditioning program. Then my patient must medical condition is stable. Dia tak ada, dia not bukan acute case, masih belum stable. Kalau if there is a fracture, dia already recover lah, dia punya healing process. And all medical and assessment report must be there. Because this work hardening program, work conditioning is the last what they call last rehabilitation. Before that, they do therapy for them in terms of their ADL, but this one focus on the work. Client has a job to return to. If the job not available, then what for you do work conditioning? So because you want to return them to the similar job, if there is no job to return, what is a work hardening program? There is no goal, and other relevant information. So in terms of successful work hardening and conditioning, the impairment, you depend on whether your impairment temporary or permanent. If permanent impairment, it's not going to work lah. Temporary, for example, back pain kan, slowly they able to recover, macam fracture or that kan. They want temporary impairment. Kalau yang permanent impairment, for example, for example stroke or that kan, it's very difficult to be success. A stroke yang very severe stroke, that one you cannot improve. Because stroke, when they have people having stroke, sometimes they affect dia punya balance or that, so it's not easy to return to work for them. Then outcome measure, this is the thing. When you want to measure your outcome in terms of work hardening and conditioning, the outcome is the numbers, the percentage able to return to work. Lost time injuries, it means that you able to reduce the injuries, the time they are off work due to the injuries. This is your outcome measure. So whenever people asking in your department, for example, how successful of your work hardening and work conditioning program. So you said that when people enter your program, 50 of them, 45 already return to work. The days of leave you able to reduce. For example, one case, they live 3 months. So you able to reduce 1 month. This is the outcome, the success of return to work. So very important that the employers that send to the work hardening conditioning program must have a policy that they commit to accommodate the workers when we return them to work. So whenever you prescribe your recommendation for them to return to work, don't write light duty. You must have parameter, as I mentioned in the previous lecture, in terms how to come out with your recommendation. So must have parameter, kan? Parameter in terms of duration, in terms of intensity, in terms of the position. So must be, you cannot write light duty only. It's like doktor lah, doktor tak buat macam itu light duty, but as an OT you cannot. To be successful, you must have a parameter. So when talk about common injuries for return to work ni, for work, conditioning, work hardening, this is usually the condition lah. Back injuries, shoulder injuries, hand injuries, carpal tunnel syndrome, knee injury, neurological disorders, spinal injuries, psychosocial dysfunction such as abnormal illness, behavior, fear, depression, but important mental disorder should be excluded. Mental disorder susah. Mental disorder bukan work hardening conditioning lah. Tapi kalau dia ada psychological, can. So work hardening concept. So this is we already done work conditioning, but this one work hardening concept. So work hardening concept is a multidisciplinary approach. Because of your client is a complex. They having a complex issue. It can be psychological, behavioral, long off work. So that's why they need a multidisciplinary approach. They need sometimes psychologists, counselor, vocational counselor, physiatrist. Physiatrist is a rehab specialist. Sometimes they need a rehab specialist. Because rehab specialist, they are coordinator. They are case manager in terms of rehab. Because they need a multidisciplinary approach. So primary goal, safety to productivity, physical tolerance, for behaviors. And then your program must be structured, supervised to 2 to 8 hours, 5 days per week. So you see, the time is longer compared to the work conditioning. There are this work hardening, the days is per week. Because we want to really simulate the hours of their work. And then inside that, they have this simulated work tasks, functional activities, cardiovascular conditioning, body mechanics, and strength and stress management education. And one of these, the concept of hardening is adult independence. I mean, we treat them as an adult. They understand their goal. Whenever we plan task for them, they're able to follow, they understand. And then self-identification and control. I mean, they're able to understand their limit. Self-identifying their limit. So what the limit they have, and then they are able to control. So this more adult approach, adult approach in terms of work hardening concept. So this physical space and personal requirement needed. So when you having this program, work conditioning hardening program, you must have facilities, kan? Facilities. So the square feet, 1,000 square feet. 1,000 square feet ni quite big, kan? Quite big. So it's like our lab, our work lab. So when you're having 1 square feet, so you're able to accommodate 10 to 12 clients and equipment. So because you see 1,000 square feet quite big, kan? But when you put equipment, when there is a body there, so the place quite conducive lah. The size you needed is 1,000 square feet and open all areas visible to staff. That's why you see the lab is open, not like pediatric case, kan? Because we treat them as adult, we are able to visualize them. And your floor must be concrete. So if you want to put carpet, also good, because carpet reduce slippery, not slippery. So in our lab, it's a good dia punya layer tu bukan carpet tapi ada satu yang dipanggil saya lupa. Nanti saya beritahu. So this is the place because we want to reduce slippery, kan? Sebab banyak aktiviti intense dekat when we conduct this work hardening program. And then the ceiling accommodate tall ladder about 10 feet. So because your ceiling must be 10 feet because you in this work hardening program you're going to do a climbing ladder task, kan? Climbing ladder task. So the floor should be 10 feet minimal. And then lighting adequate to prevent eye strain. So lighting you must be distributed. You cannot just one light, two light. It's good that your light equally distributed. So this to prevent eye strain. Sometimes, so you need good lighting. So this is a sample of work hardening and conditioning layout plan. So this when talk about work conditioning, work hardening, you need a gym, equipment gym and work simulation activities. So this is very important, because inside the work hardening program you must have gym. Why you want to have a gym? Dalam gym tu ada physical exercise, treadmill. They want to improve dia punya cardiovascular, kan? And dia punya strength. In order to stimulate physical body demand, the latter should approximate as closely as possible to the actual work environment in terms of noise, light, humidity. So the punya environment must be relate to the work area. Tak perlu aircon sejuk sangat. Then there is a room for counselling. Some of the case they need counselling. They must have a room also lah. Room for counselling. So additional treatment should be available. Access to gym hall for group exercise. For example, aerobic, low impact game. So sometimes there is a group punya exercise. There's you need some room. Bukan room lah. you space dia. Space dia. For example, like this. Nampak tak semua? Okay, I will show you the video at this at this rehab center dekat Sok-Sok sana okay, this video. Okay. So in this video, you can see this. There is a simulation of job tasks in terms of pushing, and then in terms of lifting, lifting and also pushing, lifting, and also from waist to floor activity lah. So kalau you tengok sini, this is an example when this fella probably dia punya job ni pushing kan, and also lifting, lifting and so they have to do this task. So the duration, for example, half an hour, and then the range is about 200 meter, and so you can grade kan the punya activity. This is very light kan, below 1 kilo. So you can increase the weight according the punya job demand. Probably this is the starting point lah, baseline for him to start this simulation task exercise, pushing, lifting and lower bending, bending exercise. So nampak tak semua? Nampak ya?
Nampak kita.
Okay. This area work hardening program dekat Pekeso. You tengok yang dekat sini so these people, fellow ni, they want to the person walking kan. Bila walking, kalau tempat kerja there is tempat yang ada steep kan, ada tinggi, turun, naik, and so they training lah, macam tempat dia kerja ni. Okay, so the equipment that been put in the work hardening program must be functional, functional approach, job simulation to re-enter workforce and meet injured workers' need, and then more job specific tasks for endurance. You see, yang video I bagi tu, you want to improve dia punya job specific task. So dia punya job specific task for that person, pushing, bending. So you want to improve dia punya endurance. Endurance in term of, when talk about endurance, timing lah. So you improve dia punya time. For example, starting point 50 minutes. Then after that you increase to 30 minutes, 45 minutes, 1.5 hours. Then dia punya intensity, dia punya workload, in term of berapa kilo, improve all that. So equipment recommended immediately in work hardening and work continuation program. A set of device for resistance training and system work simulation system. For example, box, brick wall assembly, and added letters such as job specific workstation. So this is the equipment yang adalah patutnya. For example, like this SOXO. This I want to show you the video in SOXO. Okay. Kalau you tengok condition video ni, sakit ni apa dia punya condition? Condition apa? Sakit apa?
Stroke.
Okay, good. Ras itu. Okay, this one, kalau you tengok video tadi kan, this person berjalan, probably this person working as construction. So dia berjalan tempat yang uneven, and then ada apa ni, kayu sempit kan. So we want to improve dia punya walking endurance. Walking endurance. So that's why they use this work hardening program. So when people entering into your work hardening program, you have to do orientation, do a stretching, strengthening, conditioning, and then at the same time you do stress management, how to handle stress. Sometimes we do ADLs. ADL they have to do themselves. We go to toileting, changing clothes, go to cafeteria, eating, they have to do their themselves. For example, like the previous video tu, they're having a stroke, kan? Probably the issue of feeding themselves, dressing themselves. So they have to do their own. So you have to train. If there is a deficit, kan? But however, this thing should be done before they enter to work hardening program ni lah. They have a therapy lah. Then they do doing a work task that simulate their job requirement, job demand, and then you have to teach them proper body mechanics, proper in terms of lifting, carrying, walking, sitting. You must train them. Then you analyze their job. Very important because you want to mesh their job ni kan. So you need to analyze their job, then you return them to work. This is the process of work hardening program. This is an example of before they enter to work hardening program, you must understand their job description. What job title they are. For example, job he's working as a technician kan. Dia tu punya job title juruteknik elektrik, juruteknik kimpalan, welding for example lah. And then how many hours they work? Overtime how many? Do you have breaks? And then the task, the activities they do in their work every day lah. One day, for example, they have to drive, they have to walk, stair climbing, sitting, twisting, stand, bend over, squatting, kneeling, reaching. So for how long? You must understand the duration. And then dia punya load, kalau tahu kalau ni tak ada load, this more on dia punya task every day. And then pushing. For example, like the previous video, dia ada pushing, pulling. How far? How far? And then how much weight involved? What type of surface of them to push? Does the unit have wheels? So which picture best describe you when you push? So why we want to know the technique of them to push? Probably you can educate them the proper body mechanic in terms of pushing. So this is the thing. In terms of job description, you have to assess your client. Then in terms of lifting, if they involve lifting, what do you lift? How many pound, kilo? What distance your lift? For example, you need to understand the distance of their lift. From floor to waist, waist to shoulder, from floor to shoulder. So you need to comment on it because you want to educate them proper body mechanics. Then you want to understand what are their job requirements before you conduct work conditioning hardening. Does your job require any carrying? Carrying can be unilateral, bilateral. What type of object? How many weight you carry? What do you carry? You need to understand that because you want to simulate the job task in your work hardening program. And then, do you have any special equipment? You need to understand. Are you right or left-handed? Task description. Is there any repetition? What are the material they handle? The production, and then the standard. Because you want to do one in the program that match dia punya job requirement. This the term of when you do job analysis. You want to do work visit, or you can interview them lah. You want to analyze term of dia punya requirement. When they do their job. This is the punya task. More specific in terms of duration, distance, and the punya load, the punya weight. How much? Because you want to simulate your punya program. This one more on workstation. Workstation, if dia punya job ni ada station. Dalam workstation, berapa spend time for sitting, standing, walking, ada punya desk, dia punya seat. So all these things about job analysis. So when your client enter your work hardening program, they must punching a clock. Why we want to punch a clock? Because we want to create this the real job punya goal. So we want to have a discipline. Kan disiplin macam you all ni kena ada punch clock, tengok pukul berapa datang, kan? Kita nak nak improve dia punya behavioral aspect. And then clipboard is like schedule for them to do what are the tasks that we given to them. And then they have to do stretching and body mechanics. This stretching and body mechanics, you need to familiar. You need to know how in terms of do stretching with them. Then they have to do cardiovascular activities. Cardiovascular is more on aerobic, exercise. You want to improve their cardiovascular. And then normal work day. And then they have to do the task in circuit. In circuit circuits mean there is a continuity. The task for task 1, task 2, task 3, task 4. So circuit is the continuity of the task. Task dia mesti berterusan because you want to make sure for example, they work 8 to 5 kan. 8 to 5 must be continuity. Kena reflect dengan kerja dia. And then social dynamics. Some of you can create social dynamic activities. For example, like coffee break together, making a sandwich together, celebrate birthday. That is a short social dynamic activity. And very important, stress management. It must include in your hardening program. Punctual o'clock. Why? We want to stern. We want to stern. We want to discipline them in terms of we want to make them serious. This is not the holiday kan. This hardening program. You want to improve dia punya work performance. Clipboard, day program and discuss changes. Day program, so you kena ada task dia ni every day. If there is changes, you need to highlight in the clipboard ni. Nota, clipboard ni. And then stretching body mechanics, very important. This is to improve client flexibility and body awareness. So you kena train before start working, start yang punya work hardening, you kena buat this stretching, body mechanic. Correct body mechanic, and then you need to educate proper body mechanics. Dia punya habit, daily task, and not only at works but also at home. When they leave their children, when they leave when they do housekeeping kat rumah, so you kena ajar dia body mechanic yang betul. Awareness program, for example, awareness program, you shouldn't perform this posture while you do work kan. Kalau you perform like this, what happen? You can have fatigue and ligament stress in your trunk. So educate them. This is a poor posture. So how to do a proper posture? Macam mana nak ajar? Anyone?
Bend knees.
Bend, yeah, very good. Bend your knees when you do the floor task. Or you come out with the stool, kan? Sitting stool. Sitting stool, kalau contoh kita basuh kain, kan? Soal basuh kain ni, buat bongkok macam ni ke? Kan? Belilah stool. Stool yang boleh duduk tu. Untuk reduce this poor posture. While performing activity at floor. So this is like education. You educate your client. This is a poor posture. Kan dia tengok dia ada awkward posture ni. Tak sesuai lah. Probably you can suggest modification in terms of the leveling this place, not above shoulder. Or you bagi stairs kat dia. Tangga yang mini tu untuk dia panjat. So you educate them. For example like this. Kalau above, you do awkward posture. This lady dan apa ni above shoulder. Dulu masa saya kat PLPP Bangi ada student datang. Student macam you all lah. Datang, so I ambil gambar untuk I educate my client macam mana apa ni posture yang tak betul ni this one like this, so this person need to climb stairs lah, kena ada stairs, step lah, ladder tangga untuk dia avoid this ligament stress dekat dia punya wrist ni. This one awkward posture. Sorry. This one, this one. So betul ke buat komputer macam ni? Kan? This one can give stress to your cervical. So you kena educate dia macam mana nak perbetulkan posture ni. So level, my rule of thumb, your elbow must be 90 degree, your eye level, dia punya tinggi, dia punya seat kena ubah, tinggi dia punya paras not below 15 from your eyes, but you need to highlight this. Sometimes even people yang teach ergonomic ni, dia tak aware diri dia. You kena educate the client while typing. You cannot do ulnar deviations. Stretching exercise. Stretching exercise sebelum buat kerja kena train dia orang buat shoulder exercise. Shoulder exercise, arm circle, stretching the arms behind, back and in front of the chest, shoulder shrug, pendulum swing. This for shoulder exercise. So you kena train you punya client. Then neck exercise. How to do neck exercise? Bend head backward, forward, bend head side to side, turn head side to side. This is a way to do exercise. And exercise for people yang buat typing. Bila buat typing, you kena ajar dia hand exercise. Mana pergi saya punya ni. So you want to do hand exercise for them. Buat fist and then open it, squeeze fingers together and then stretch them apart. So you buat exercise. This is to avoid a case like worst scenario, carpal tunnel syndrome, tendinitis, all that. So you need to teach them massaging the palm and the back of the hand for people who doing repetitive jobs, repetition. They need to do this exercise. Back exercise, very important. Back exercise, bending backward, stretching the arm, twisting the trunk from the side. So this is very important for people yang do lifting. The job is lifting, carrying. So they have to do back exercise. So you have to teach them how to do back exercise. If you don't know, you go to YouTube. YouTube ada cara-cara. So you practice yourself, and then after that, if you got client, you teach them, demonstrate to them. This for people do job as a sitting job, or people yang ada injuries lower limb or that. So how they do stretching exercise while sitting. You can do it while sitting. And then calf stretching, quadricep stretch. How to do calf stretching while they standing. If they have wall, how to do at wall. How to do for the stretching exercise. So you should teach them. Body mechanics, the correct movement, habitual, daily tasks, balance home and works. So you have to teach them this proper body mechanic. Then cardiovascular activities, regardless area of injury, you need to increase their endurance and bring circulation. So you kena buat cardiovascular activities dalam buat ada program. Mana gambar air ni, cardiovascular dah hilang. Cardiovascular kalau you boleh buat kat treadmill, senam aerobik, dan stress management, you boleh ajar je how to handle stress, prioritize your time, manage your time, do relaxation. You all semua dah belajar kan intervention, Jacobson technique, visualize technique, deep breathing technique, buat diary pada dia, so you ni then normal work day. Normal work day, for example 4 hour, the break only 50 minutes. Kalau 6 hour working, break dia either 15 or 30 minutes. 8 hour, 15, 30, 50 minutes. So, you need to follow what are the break routine. If you do 4 hour, 6 hour with them. Okay, circuit, job broken into small enough component. Job task simulation to identify any problem of the task, to correct problem, and you need to educate in terms of how to control if they have pain. Control technique, if they have pain. So you need to break the job into small components. This is what circuit. There must be continuity. Continuity. And then there is a study. When you need to have education. So there is a study found that if you do individual patient education for low back pain, there is a significant difference between the people who don't have any pain management. Where there is no individual pain management, the result is significant. So whenever you do hardening program, when there is a pain, how to manage pain and how to manage pain, kan? How to manage pain, guys? So how to manage pain can be done while you go back, sleeping. For example, if there is a pain, avoid position that can cause pain, kan? Or you do wax baths ke apa ni, bagi minyak panas ke, positioning, all that, can do it. For example, like this. Siapa ni? You kenal tak ni siapa lecturer ni? Kenal tak? Siapa ni? Tak kenal ni?
Kenal.
Siapa? Aneh ni, aneh.
Tekanan ni.
So when people going back, kan there is a pain at the back, no? Macam mana nak position, nak relieve pain. So you can educate patient. So when they go back, do this position. So this position can relieve the pain, back pain ni. Letak bantal, letak kursi, kan? This is the way lah how to manage pain ni. When dia masa ni muda lah, nampak muda kan? When dia side lying, kalau you sakit belakang ni, I cakap dengan you, kalau you buat lateral punya side lying, You boleh letak bantal between your knee and it will be reduced, and then you have to put support dekat you punya back ni, sebelah lateral ni. This is to stabilize the spine. Bila you punya spine stabilize, you are able to reduce pain. Then buat stretching exercise at prone position. Macam Mr. Kanan buat ni. Buat stretching. So you have to educate your client. Education is one of the part of your program. Cardiovascular activities. Cardiovascular ni, dia berjalan, berapa jauh dia dah biasa jalan ni kan. Macam bomber ni, dia jalan berapa kilometer. So dengan pakai baju bomber ni, dengan pakai dia punya gas ni, berapa berat. So buat dia exercise. Cardiovascular. You can buat aerobik juga kan. Aerobic exercise, senaman exercise dekat kursi roda, buat exercise. Ini kena buat cardiovascular activities. Job task stimulation. Dalam circuit tu ada job stimulation, job task stimulation, atau identify any potential problem task to correct the problem in a supervised environment before returning to the job, pain control technique, and to identify alternate method to allow completion of the task. So dalam job stimulation ni, you kena tengok apa problem task dia, yang job demand dia tu, apa dia punya problem yang dia hadapi, and then you want to correct sebelum balik kerja. You sometimes you accommodate, you buat alternate method to complete the punya task. So when you already got the job description, job demand dia, so you plan apa task yang sesuai. For example, like this work simulation, what this fella do ni? Apa dia buat ni guys? Ini untuk orang buat construction. Construction, dia nak buat beam, dia nak buat foundation. Kalau buat flat, rumah tingkat ni kan, dia kena ada structure, dia kena ada beam dia, kena ada besi. So besi ni nak ikat ni pun satu, kalau tak ada kekuatan, sakit belakang pun tak boleh buat. So dia dalam keadaan, you tengok, ada bend kan, sepatutnya dia kneeling. So you kena educate dia, kedudukan posture yang betul kita buat. So you simulate apa salahnya kalau beli besi ni kan, so dia ikat besi ni, dan after that suruh dia buka, dan you simpan besi tu. Dah jadi satu sesi terapi work simulation pada dia. Okey, ini yang kerja apa? Kerja construction yang buat scoping kan, the scope, guna scope ni. Dia tengok sini, kayu ni kita buat penghadang sini kayu ni. So bila dia scope, benda ni turun balik. Scope, turun balik. Sebenarnya kita nak simulate work task kan. Scoping. Scoping ni kena ada kekuatan. Kena bending. Then we start kita buat dia punya, janganlah gravel, janganlah batu, buat dengan yang ringan dulu, macam abuk papan, kayu papan, kayu-kayu nak potong halus tu ringan sikit. Then after that kita upgrade lah, grading lah. Kita buat pasir, kita buat batu gravel, benda tu akan jatuh balik ke sini. So you buat simulation task ni, for example, for starting 5 minutes guna yang kayu. Boleh tak dia buat simulation task ni? Kemudian you upgrade timing dia tu, buat dalam 20 minit, 30 minit. Then after that you intensity loading dia tu, you tingkatkan. So you kena grading. Pushing, ini Keadaan berat ni kita tambah bucket of water untuk tambah beban dia ni. Untuk kita buat pushing. Kalau dia kerja melibatkan pushing. Ini contohnya pushing ni. Ini yang ada masalah buat bolting, buat screwing. Kadang kita kena bantu dia. Kalau dia lemah, ada stroke, kita kena bantu dia. Ini drum, kalau dia kerja buat drumming kan, move the drum, move the gas kan. Tong gas tu pun kalau sakit belakang, macam mana nak gerakkan tong gas tu. So you boleh guna tong gas, drum untuk buat trunk activity. This one, kalau task yang melibatkan above shoulder, to lift above shoulder, mula you pakai kabus dululah. Janganlah benda yang terlalu heavy. Start with the kabus dulu, masukkan benda ni, letak plastik dan benda ni boleh continue. So benda ni continuously this person do so you kena set time kan, berapa kali dia kena buat. So dalam aktiviti work hardening, ni yang guna rollator. Kalau dia tak boleh angkat dulu, buat rollator untuk dia gerakkan benda ni. Simulate the task. Tempat kerja tu mungkin pakai rollator. Kalau dia melibatkan kerja, is woodwork. Woodwork is very good. Very good sebab dia melibatkan banyak joint. Flexion, extension of the shoulder joint. Kalau dia ada shoulder injuries. On that kan. And then bila dia dapat hasilkan sesuatu, dia very satisfying. Carrying above shoulder, the brick dan sebagainya. So boleh dia boleh buat kerja tampal dekat dinding kan. Tampal dekat dinding dan sebagainya. This one simulated assembly yang menggunakan eye and foot coordination. Kita ada eye and foot coordination. If the job task ni melibatkan eye and foot coordination, kita boleh guna these tools. Then work simulated assembly, benda ni akan berpusing. So kalau dia ada injuries dekat dia punya hand, dia ada perception problem, motor hand control problem, finger dexterity problem. So you can using this simulated assembly. This one more on coloring, coloring, and also size discrimination. Coloring and size discrimination. So people yang involved di task, you can use this simulation. Tapi tempat kita tak ada. Ini dekat PLPP Bangil. It's very good. People yang kerja melibatkan color, size, shape, form perception. So they can use this work task. Work cube yang you nampak tu, work cube ni dia ada different task. So I want you all at the same time before coming to the lab, you look at the YouTube lab 2. Lab 2 I already outline the YouTube of the primers. Bukan workcube lah, kita punya primers tu. So workcube you can buat unilateral carrying. Unilateral carrying, so you can increase dia punya load, dia punya weight. Pushing, lifting. So dalam lab nanti saya akan bagi task kat you. Screwing. So people yang guna plier, screwing, all that, they have this, can use this one. Climbing, ladders. And then you have social dynamics. I mean, social dynamics is stimulate social skill. After several months, sometimes they've been isolated off work. So you can do activity that involve in group together. They do it in group. So writing hardening program, you need to do it in a safe level. So you need to have indicator. So I have already highlighted to you all an NOFC. NOFC. Occasional is 1 to 30%, 1/3 of work daily. If they do the work, 1/3 of the work daily. This one frequent, 34 to 60%. So 1/3 to 2/3, and then continues 2/3 to 1. Work daily. So you need to have indicator in terms of the progress, whether they can do occasionally, frequently, or continuously for the 8 hours working. So this is the daily schedule. You see the daily schedule. There is a date and the number of hours what they will do. So you need to have a daily schedule for them. Today, Monday, what they should do. You have to spend 2 hours do work, do apa? Before that, stretching. How many? 50 minutes stretching, aerobic exercise, 30 minutes. Then what are the hours they spend? 30 minutes and 2 hours simulation. So you need to have a daily schedule for them. And then you have to write the progress note. So is there any improvement? Is there any improvement to them? Okay. So progress note kena buat lah. So this bulan ini is bulan berapa, hari berapa, apa progress dia. Kena ada progress. So we want to know that whether they were able to achieve or not. What the goal that you set for them. I think that's it for work conditioning and work hardening. And for your homework, I'd like you all to read this article. First article regarding individual education for low back pain, systematic review. Then second article regarding work conditioning, work hardening for functional restoration for low back pain. Then article 3, physical conditioning program for improved outcome in workers with back pain. And article 4, behavioral treatment for chronic low back pain. So this is the article that you should read when you go back to your college. And then I want you all to go through YouTube. YouTube before you start your lab for Wednesday and Thursday. Kan? Buat tengok YouTube tu, nanti kita akan bagi penerangan lanjut dalam lab. Okay, semua ada soalan tentang tajuk ni? You got any question to ask me? Forty-five. Ada yang missing lagi. Ada soalan?
Tak ada.
Supriza mana Supriza?
Ya, saya doktor.
Ada Okey, ada soalan Supriza?
Tak ada je ni doktor.
Okey, clear So apa yang tak kalau ada yang tak faham boleh tanyalah sekarang. Anything Zuain? Zul? Ada soalan Zul? Tak ada. You lepas ni apa dia Zul? Tak dengar Zul. Zulain.
Tak, saya cakap second hoki je. Je.
Apa dia? Tak dengar Zul. Kuat sikit.
Tak, maksud hoki je.
Okey je. No Syairah Jamaluddin. Syairah ada soalan?
Tak ada doktor.
Okey, baca artikel ni ada 4 artikel tu. I need you all to read the article lah. Ini degree bukan setakat dengar lecture je. You all also have to dig yourself in term of the knowledge. Kalau you baca lagi you faham rather than you just dengar lecture notes article. That's why in our line ni evidence based we follow evidence based for example you want to introduce the work hardening program. So the department head department will ask you, is there any evidence? How are you going to answer that? Is there any evidence? For example, you want to do education, session for them. Is there any evidence you want to do education? You want to teach stress management? So everything must based on evidence. I know that you right now study biostatistics, all that lah. So it's good lah. You understand the evidence, right? So your evidence is there already. I already find for you. Rather than you all find your own evidence, the evidence is already there, and so you need just to understand, read it, the evidence. Okey semua, kalau tak ada soalan, I finish right now lah. Hope you all baca artikel tu and then selamat berpuasa. Nak buka lama lagi. Okay, I'll see you on the lab on Wednesday and Thursday. Okay, Assalamualaikum semua. Bye.
Terima kasih doktor.
Thank you doktor.
Thank you, doktor.
Doktor. Salam doktor.